The following presentation is an introduction to Medicaid health homes and health home referrals. There are four main training objectives of this presentation. 1. To understand the essential need for care coordination and care management and the role of the health home in care management for your Medicaid patients. 2. To develop an increased awareness and understanding of Medicaid health home services. 3. To understand the process of identifying and referring Medicaid health home eligible patients. 4. To gain the knowledge and skills necessary to leverage community-based partners like health homes in order to enhance the patient experience, improve quality, and reduce costs. Navigating our current healthcare system can be challenging, especially for those with severe or complex chronic conditions. For many Medicaid recipients, this problem is exacerbated by certain social determinants, like low income, unstable housing, unreliable transportation, or substandard education. Providers are discovering that changes in our healthcare landscape, which include improving care coordination, management, and service integration, are necessary for improving health outcomes and reducing costs. This model of care coordination and care management is called health home. A health home is not a physical home. It's a Medicaid care management service model where a network of caregivers, including providers, health plans, and community-based organizations, work together to provide individuals with a comprehensive, efficient, and quality care. This is all under the guidance of a health home care manager who serves as an advocate, helps patients understand and manage their conditions. The health home care manager works with patients to create a plan of care that meets all of their social and health needs. The care manager makes sure patients receive the right services at the right time by coordinating with the necessary service providers in the community. This helps patients stay healthy and educated and helps to prevent unnecessary hospitalizations and costly emergency room visits. Health home providers will integrate and coordinate all primary, acute, behavioral health, and long-term services and supports to treat the whole person. A health home is free for the patient and the provider, and health home care managers provide services that are advantageous for both patients and providers. Health home care managers develop individual care plans to identify needs and services for each patient. They develop appropriate goals to monitor progress. They coordinate care, promote health with designated service providers. They facilitate collaboration with all providers. They assure timely access to follow-up care, provide individualized plans of care to reflect the needs of the patients and the patient's family. They coordinate care with community and social support services according to the patient's needs. And they have access to HIT technology in order to link all necessary support services. So who qualifies for health home services? There are three main requirements. To receive health home care management services, one must be Medicaid eligible. Now this includes active New York State Medicaid, Fidelis Managed Care Medicaid, Excellus Managed Care Medicaid, United Healthcare Managed Care Medicaid, MVP Managed Care Medicaid, and Medicaid Medicare. Along with the Medicaid eligible criteria, individuals must also either have 2 or more chronic conditions or one single qualifying condition of either HIV/AIDS or serious mental illness. An individual must have significant behavioral, medical, or social risk factors to deem them appropriate for health home services as well. The risk factors are described in the next slide. Risk factors that demonstrate need include the following: probable risk for adverse events, lack of or inadequate social, family, housing support, lack of or inadequate connectivity with healthcare system, non-adherence to treatments or medications or difficulty managing medications, recent release from incarceration or psychiatric hospitalization, deficits in activities of daily living such as dressing or eating, and learning or cognitive issues. Here's the enrollment referral process. Step 1 is to determine if a patient meets the eligibility requirements discussed prior. Step 2 is to complete a health home referral form. A link is provided for you in this presentation. There are a number of ways that a patient can be referred. Patients can be referred by Medicaid or by the provider. Patients can even refer themselves. Number 3, once the referral is complete, it's sent to the lead health home main office. 4, once the lead office verifies the eligibility, the patient is connected with an appropriate care management agency. 5, the agency assigns a care manager. The manager makes contact with the patient and care management begins. The lead health home agency in the Tug Hill Seaway region is the North Country Health Home. Here are a list of the agencies that are contracted with the North Country Health Home to provide care management services: ACR Health, Cerebral Palsy Association of the North Country, Children's Home of Jefferson County, Credo Community Center, HCR Care Management, St. Lawrence County Community Services, Transitional Living Services, and United Helpers. The North Country Health Home is a DBA of the Central New York Health Home. Remember to click the New York State Department of Health Medicaid link or email one of the NCI contacts.